You know that moment when you spot something a little off with your pet? A strange patch of skin, maybe?
Yeah.
Or they're scratching more than usual. It can set off a little worry signal.
Right, definitely.
Or maybe you're just, fascinated by animal health stuff, like I am.
Mm-hmm.
Well, today we're diving into a topic that might sound a bit technical. They're dermaphytosis, but it's actually a pretty common skin thing in our furry friends.
Yeah, and what's interesting is, despite the fancy name, dermatophytosis is essentially just a superficial fungal infection. It affects the sort of tough outer layers,
Hmm.
hair, nails, sometimes just the very surface skin layers in animals.
Okay.
Think of those little fungal spores finding a place to live where there's lots of keratin, the protein that makes up that stuff.
Right, keratin.
You might have also heard it called ringworm, although the veterinary source we're digging into today mostly just calls it dermatophytosis.
Right, sticks to the technical term. And for this deep dive, we've got a really solid resource, a detailed veterinary reference. So we're going, way beyond a quick search here.
Exactly. We're getting into the nitty-gritty.
We want a proper understanding of this condition.
And if you think about this from your perspective, maybe as a pet owner or just someone interested in animals, understanding dermatophytosis gives you, well, really valuable knowledge.
How so?
Well, it helps you maybe spot potential signs, understand how the infection actually happens, and get the basics of how vets diagnose and treat it.
Right.
Our goal today is really to pull out the most important bits from this source and, make it clear and easy to understand for you.
Okay, let's jump right in then. What are the main culprits? Who are these tiny troublemakers?
So the main ones are a group of fungi called dermatophytes, specifically ones from the Microsporum and Trichophyton groups.
Okay.
By far, the most common one we see is Microsporum canis.
Canis. Got it.
But it's also important to know that infections can come from others, like Trichophyton mentagrophytes and gypseum and even M. persicolor.
Okay, so a few different fungal villains. Now, how do these microscopic things actually, start an infection? What's the process?
That's a great question. It's about how they operate. These fungi are pretty good at using keratin as like their food source.
Right, we mentioned keratin in hair and nails.
Exactly. Hair, nails, superficial skin layers. But interestingly, they don't really do well in living tissue or where there's a lot of inflammation.
So they stick to the dead stuff, kind of.
In a way, yeah. And what's really crucial to get is that just being exposed to the spores doesn't automatically mean infection. It's not always, contact is disease.
Well, that's actually reassuring. Just
Yeah.
bumping into it isn't a guarantee of trouble.
Precisely. There's usually an incubation period, maybe around 2 to 4 weeks, between exposure and when you actually see signs.
Okay.
For an infection to really take hold, the spores have to touch the skin and then manage to get past the animal's natural defenses.
What kind of defenses are we talking about?
Things like their innate immunity, the sort of good bacteria and fungi already living on the skin, the normal flora, plus the skin's natural oils, the sebum, and even just, grooming themselves helps.
So a healthy animal with good defenses has a better shot at fighting it off.
Exactly. And some things can unfortunately tip the scales in the fungus's favor.
Like what?
Things like stress, any kind of skin injury that gives it an entry point, maybe fleas or ticks irritating the skin.
Parasites.
Yeah, they can compromise the skin barrier. And also any condition or maybe medication that suppresses the immune system.
Okay.
And here's something really interesting. An animal can carry these fungi for ages and show absolutely no signs. Some never show signs at all.
Wow.
It's like these little fungal stowaways are spreading silently,
That idea of asymptomatic carriers.
Yeah.
Wow, that really shows how easily it could spread without anyone noticing. So who's most likely to get it? Is it like everywhere in the pet population?
Well, this is where it gets a bit tricky. Diagnosing it can be hard because the skin problems it causes can look a lot like other skin conditions.
Right.
Which means it might sometimes get overdiagnosed, perhaps. The actual infection rates, how many animals have it with or without symptoms, can really vary depending on the group of animals you're looking at.
Like a shelter versus a single pet at home.
Exactly.
Yeah.
Huge difference, potentially.
Does location matter? Like climate?
Oh, definitely. It tends to be more common in warmer, more humid climates, and even the types of dermatophytes you find can change with the season or where you are, north versus south, country versus city. Even indoor versus outdoor pets might have different exposures.
Interesting.
And species-wise, we're mainly talking dogs and cats.
Okay. Are there specific breeds that seem more susceptible?
Yes, there do seem to be some tendencies. In cats, long-haired breeds like Persians and Himalayans pop up more often.
Okay.
For dogs, breeds like Yorkshire Terriers.
Well,
Manchester Terriers are sometimes mentioned as being more prone.
well.
Age is a big factor, too. M. canis, the common one, more often seen in younger animals,
Okay.
whereas the other types, the ones often linked to rodents or wildlife exposure, tend to show up more in adults.
Wow.
And it's worth noting, if you see really widespread dermatophytosis in an older dog, it might, just might, signal an underlying immune system problem.
That's a really important point to keep in mind.
Yeah.
Definitely. Okay, so what are the signs?
Mm.
What might make a pet owner think, maybe this is dermatophytosis? What should you look for?
Well, knowing if your pet was exposed, like to another infected animal or place, that's helpful history, but you don't always have it.
Right.
The key thing, honestly, is how much the signs can vary. It's incredibly variable.
But is there a classic look?
There is. This sort of textbook picture is a slowly growing circular patch of hair loss, maybe with some flaky skin, some scales.
That's the ringworm look, right?
Right.
Even though it's a fungus, not a worm.
Exactly.
Okay.
That's where the name comes from. But beyond that typical ring, you might also see a greasy or oily coat, what we call seborrheic, or even little bumps, papules, or pus-filled bumps, pustules on the skin.
Okay.
And it's really important to say again, cats can be carriers without showing any signs, totally asymptomatic.
Wow.
They can be infected, spreading the fungus, and look perfectly fine, silent spreaders.
So even a healthy-looking cat could be contagious.
Yeah.
That's
Yeah.
that's eye-opening.
Mm.
Okay, we've hit the types of fungi, how infection happens, who's more at risk. Let's circle back to the specific causes and risk factors again.
Sure. So as we said, the main players are Microsporum canis, Microsporum gypseum, Trichophyton mentagrophytes, and Microsporum persicolor.
That last one, M. persicolor.
Yeah.
You said it's a bit different.
Yeah, it often causes infections that aren't primarily in the hair follicle itself, non-follicular.
And the big risk factors.
They basically boil down to anything that weakens the animal's defenses. So a compromised immune system, maybe from diseases like FeLV or FIV in cats.
Those are viruses, right?
Yes, feline leukemia virus and feline immunodeficiency virus,
Wow.
or even from medications like glucocorticoids, those are steroids.
Right.
Also environments where lots of animals live close together, like shelters or multi-pet homes, and maybe where, management practices aren't quite optimal, those definitely increase the risk of it spreading.
Yeah, that makes total sense. More animals, closer contact, maybe harder to keep everything perfectly clean, more chances for the fungus to spread. So if a vet suspects this, how do they actually confirm it? What are the diagnostic steps?
Right, the diagnosis part. Vets have several tools. And it's also really important to think about other conditions that look similar, the differential diagnosis.
What kind of things mimic it?
Things like bacterial infections in the hair follicles, staph folliculitis, or mite infestations, dermatocosis, allergic skin disease, an autoimmune issue called pemphigus foliaceus, even problems with how the skin makes keratin.
Wow, lots of lookalikes.
Exactly, which really underlines why getting the right diagnosis is so critical. You don't want to treat for the wrong thing.
Absolutely not. So what are these tools the vets use? I think I've heard of a Woods lamp.
Yes, the Woods lamp, it uses UV light. It's often a first screening step, but, and this is important, it has limitations.
Oh.
Only about half, maybe 50% of M. canis strains actually glow that characteristic apple green color under the lamp.
Only half.
Yeah. And most of the other dermatophyte species that infect pets, they don't glow at all.
Ah.
So if there's no glow, it doesn't rule out dermatophytosis. And if there is a glow, it mostly just suggests M. canis. It's not definitive proof on its own.
Okay, so no glow doesn't mean no problem, and a glow points towards one specific type, maybe. What's next if the lamp isn't conclusive?
Then you'd move to microscopic examination of hair samples. If you did see that green glow, looking at those specific hairs under the microscope really ups your chances of knowing the fungus.
And what are you looking for?
The vet's looking for hyphae. Those are the little thread-like bits of the fungus and arthrospores, a type of fungal spore. Seeing them actually invading the hair shaft, that's strong evidence.
Okay, actually seeing the invader. Makes sense. But the source material mentioned a gold standard diagnostic test. What's that?
Ah, yes. The gold standard is fungal culture, followed by identifying exactly what fungus grows. This is really the most reliable way to confirm it.
How does that work?
The vet collects samples. Ideally, if hairs glowed, they'll gently pluck some from the edges of any affected patches. Or they might use a sterile toothbrush or even like a special carpet square.
A carpet square.
Yeah, to brush the animal's whole coat. That's especially useful if you suspect a carrier with no signs, or maybe an animal that's already started treatment.
Okay.
Then these samples go onto a special growth medium called Dermatophyte test media, or DTM.
DTM. And what happens on that plate?
Well, this media is designed to change color, usually to red, pretty early on if disease-causing dermatophytes start growing.
Okay, red means maybe.
Maybe. Because other harmless fungi, saprophytes, they might change the color too, but usually much later after there's already a lot of fuzzy growth. The dermatophyte colonies themselves are often kind of whitish or buff-colored, not pigmented.
So color change plus colony look.
Exactly. But to be sure it's a dermatophyte, and to know which one it is, you have to look at the fungal growth under a microscope.
Back to the microscope.
Yep. Looking for specific structures, like microclinidia and macroclinidia, their shape and how they're arranged tells you the genus and species. And knowing the species can sometimes even hint at where the infection came from.
Like the rodent connection you mentioned.
Precisely. But it's also important to remember, just growing a dermatophyte doesn't automatically mean active disease. An animal could, say, just have some harmless soil fungus on its paws that grows in the culture. Context is key.
Right, you need the clinical signs too. Got it. What about a skin biopsy? Is that often needed?
Not usually the first step, no. But it can be really helpful sometimes. Like if the diagnosis is still murky, or maybe the cultures are negative, but the vet still strongly suspects it's dermatophytosis.
When would that happen?
Well, the biopsy can show if the fungus is actually invading the skin tissue and causing inflammation down at the microscopic level.
What would they see?
A pathologist might see inflammation in or around the hair follicles, folliculitis or perifolliculitis, maybe even ruptured follicles, which is furunculosis. They might also see thickening of the skin's outer layer, hyperkeratosis, maybe little pus pockets, or a specific inflammatory reaction called a pyogranulomatous reaction.
Okay.
And they can use special stains on the tissue slices to make any fungal bits really stand out and be visible.
Okay, so biopsy for tricky cases. Right, so we have ways to diagnose it.
Right.
Once you know it is dermatophytosis, what can be done? What are the treatment options?
Good news is most animals can be treated as outpatients at home,
Okay.
but because it is contagious to other animals and potentially to people, it's zoonotic.
Meaning it can pass from animals to humans.
Exactly. So quarantine, especially if you have other pets, is definitely something to consider seriously.
Makes sense.
Client education is also huge here. It's interesting, many short-haired cats in single cat homes, and lots of dogs too, might actually clear the infection on their own within about 3 months. Spontaneous recovery.
Really? Their immune system can just beat it.
Sometimes, yes. But even if that might happen, treatment is generally still recommended. Why? To speed up recovery, and really importantly, to cut down on shedding those infective spores into the environment.
Reduce the spread.
Exactly. Less risk for others. And for long-haired pets, clipping the hair is really, really crucial. It helps get rid of contaminated hair and lets topical treatments actually reach the skin.
Clipping, okay. And what about cleaning the house, the environment?
It's essential. Thorough disinfection is key. Now, the spores get shed, but they don't actively multiply out in the environment like on your carpet.
Oh, that's good to know they're not breeding in the sofa cushions.
Right, so getting it just from the environment without an infected animal around shedding more spores is actually pretty rare. But you still need to clean up the spores that are there.
Okay, so disinfection is still vital. What works? Bleach.
Diluted bleach, yeah. Sodium hypochlorite, about 0.5% solution. But be careful, fumes can be toxic. If mixed with other cleaners, it can irritate skin, and obviously it bleaches things.
Good point. Anything else?
There's enilconazole, comes as a spray or fogger, needs about 10 minutes contact time. Accelerated hydrogen peroxide is another option. Again, 10 minutes contact, but don't mix it with bleach products. And potassium peroxymonosulfate in a 2% solution also works against M. canis and Trichophyton.
Okay, several options there.
And one more thing. Treating this, especially in homes with multiple pets, or if it keeps coming back, it can be, well, frustrating and sometimes expensive.
I can imagine.
So if things aren't clearing up, getting a referral to a veterinary dermatologist, a skin specialist, might be a really good idea.
That's good advice. Don't struggle alone. Okay, what about the actual medications? What drugs do vets usually reach for?
Yeah, so typically the best approach is often a combination, using both topical treatments and systemic medications.
Topical meaning on the skin, systemic meaning pills or liquids?
Exactly. Topical therapy clipping, rinses, shampoos helps reduce the contamination on the surface and kill fungus there. Just be aware sometimes things might look a little worse initially when you start topicals as the affected hair gets treated or removed.
Okay, what kind of topicals?
Common rinses include lime sulfur solution.
Lime sulfur. Sounds potent.
It is effective,
Yeah.
but it smells strongly of sulfur, like rotten eggs, and it can stain light fur yellow.
Ah, the smell and stain factor.
Yeah, there are also rinses with miconazole and chlorhexidine combined, or anilconazole, though again, anilconazole isn't technically approved for pets in the US.
Gotcha. What about shampoos?
Medicated shampoos with things like ketoconazole, miconazole, or climazole are also used, but you usually need to leave them on for at least, say, 3 minutes for them to work well, and their effect doesn't last long once rinsed off.
So frequent bathing.
Often, yes, and it's usually wise to use an Elizabethan collar, the cone of shame,
Right.
especially with cats, to stop them licking off and swallowing the topical stuff.
Good point. Okay, so that's topicals. What about the systemic drugs, the ones they take internally?
Right. Those work from the inside out. Grisofulvin used to be a mainstay. It works, but it's used less now, partly due to cost and potential side effects.
Okay. What else?
Ketoconazole is another one. Its effectiveness against M. canis can be a bit hit or miss, though, and there's some resistance reported. Used in dogs, but generally avoided in cats because of side effects. In dogs, it can cause appetite loss or vomiting sometimes.
Okay, so ketoconazole may be for dogs, but watch out.
Then there's itraconazole. It works similarly to ketoconazole, but is generally seen as more effective and with fewer side effects.
Mm-hmm.
It can be pricey, though. Ah, the cost factor again.
Yeah, it's used in both dogs and cats.
Hmm.
Sometimes vets use different dosing schedules, like pulse therapy on medication for a week, off for a week, to help manage cost and potential side effects. And it's usually best to use the manufactured version, not a compounded one, to ensure it's absorbed properly.
Okay, itraconazole seems like a strong option, but maybe expensive. Anything else?
Probenifine. This one can be helpful, especially if the fungus seems resistant to those other azole drugs like keto and itra.
Okay, terbinafine for resistant cases.
It's used in dogs, even carriers without signs, and cats. Potential side effects can include tummy upset, liver issues, and sometimes, rarely, blood cell problems.
So, quite a few options, but they all seem to have potential downsides to watch for. Are there any drugs that should just be avoided altogether with dermatophytosis?
Yes, absolutely. Corticosteroids like prednisone, big no-no. They suppress the immune system, which can make the fungal infection much worse.
Okay, no steroids. And grisofulvin, that older drug, shouldn't be used in cats with FLV or FIV. Also, it can cause birth defects, so definitely not for pregnant animals. It's a teratogen.
Right. And you mentioned potential side effects for the others, too.
Yes, always precautions. Ketoconazole, watch the liver, can affect hormone production. Itraconazole, high doses, rarely linked to vasculitis. Also potential liver issues, though less common. Terbinafine, GI upset, liver, sometimes bone marrow issues, and it can interact with other drugs. Even the topical lime sulfur, if they lick a lot, can cause mouth sores.
Wow, so really crucial to follow the vet's instructions exactly and report any issues immediately.
Absolutely. Close monitoring is key.
Are there any other drugs sometimes tried? I think you mentioned one used for fleas.
Ah, lufinuron. Yes, it's mainly a flea drug. People looked into it for fungus, but studies showed it's just not effective against dermatophytosis.
Okay, so lufinuron is out.
And fluconazole is another antifungal. It's sometimes used, but there isn't as much solid scientific proof of how well it works, specifically for dermatophytes in pets compared to, say, itraconazole. It might be less expensive, though.
Okay, so treatment seems pretty tailored, requires careful drug choice and monitoring. How do vets know when it's actually working? When can you stop the meds?
This is such a critical point. Just because the skin looks better or the pet stops scratching, that doesn't mean the infection is actually gone.
Really? It can look clear but still be there.
Yes. The only truly reliable way to monitor treatment and confirm it's cured is with repeat fungal cultures.
Back to the cultures.
Back to the cultures. Vets usually recommend doing them again near the end of the planned treatment course. And the general advice is to keep treating until you get at least 2 negative cultures in a row, often a week or 2 apart.
2 negatives to be sure.
Exactly. For tough cases, maybe even weekly cultures using that toothbrush technique might be needed. And depending on the systemic drug, the vet might also want blood tests during treatment, checking blood counts with grisofulvin or liver enzymes with keto, itra, or terbinafine.
Okay, patients and follow-up cultures are essential.
Hmm.
Got it. What about stopping it from spreading or coming back? Prevention.
Several key things. If you get a new pet, especially from a shelter or breeder, it's smart to quarantine them initially from your other pets and do a screening culture, even if they look fine.
Screen new arrivals. Good tip.
If you've had issues before, think about whether rodents could be playing a role, maybe carrying it into the environment.
Right, the wildlife connection.
And consistent, thorough environmental cleaning with those disinfectants we talked about, absolutely crucial, both for stopping spread and preventing it from coming back.
Keep cleaning.
Yep. If you know it was a soil fungus, a geophilic type, try to avoid letting your pet dig in or hang out in potentially contaminated soil areas. And sometimes, if a healthy pet was definitely exposed to an infected one, the vet might suggest preventative antifungal treatment for the exposed animal, just in case.
Okay, be proactive with cleaning and new pets. Are there any common complications from the dermatophytosis itself?
The main complication our source really flags is actually a diagnostic one, getting a false negative culture result.
Ah, the test saying it's clear when it's not.
Exactly.
Yeah.
That can happen for technical reasons or if there's just very little fungus present, and obviously that messes up diagnosis and monitoring.
Yeah, that would be tricky. So finally, what's the usual outcome? What can people expect? The prognosis.
Well, like we said, many animals, especially healthy ones, might clear it on their own in a few months. But treatment really speeds things up and crucially cuts down on environmental contamination and risk to others. Persistent infections can happen, especially in long-haired cats or in homes with lots of animals where getting rid of all the spores is really tough. But overall, with the right treatment and good environmental management, the prognosis for getting rid of dermatophytosis is generally good.
That's good to hear. Okay, so let's just quickly recap the big points from this deep dive. Dermatophytosis, common fungal skin infection, hits the surface layers, hair, skin, nails.
Right. Getting an accurate diagnosis is vital, and fungal culture is usually the best way, the gold standard.
Treatment often needs both topical stuff like shampoos or dips and systemic beds, pills, or liquids. And cleaning the environment thoroughly is non-negotiable.
Absolutely. And remember how variable the signs can be, and that some pets, especially cats, can be carriers spreading it without looking sick at all.
Definitely.
Oh.
It really makes you think about how adaptable these fungi are and how complex the interaction is between the fungus, the pet's immunity, and their environment.
Yeah, and getting a handle on these basics really helps you, as someone who cares for animals, be more observant, more proactive about their health.
Totally. And it kind of leaves you wondering, given how easily these tiny spores can spread, what other maybe seemingly small things in our pet's environment might be playing a bigger role in their health than we even realize?
That's a great thought. Or, with pets traveling more, being adopted from different places. How might the types of dermatophytes found in different areas keep shifting, and what could that mean for diagnosing and treating it where you live?
Definitely food for thought. Well, this has been incredibly informative. Thanks for diving deep with us today.
Absolutely. It's been a really interesting discussion.